Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department, and this is our COVID-19 update for the week. I'm here with Julianne and Dr. C. I'm going to let them introduce themselves.
Thanks, Janelle. Hi, everyone. My name is Julianne Van Loo. I'm the director at the Health Department.
And I'm Dr. Erin Corriveau. I'm the Deputy Health Officer here at the UG Health Department.
All right, and we've got a few things we're going to talk about today. I know people have been hearing a lot about how COVID numbers around the metro are moving in the wrong direction. So we're going to talk about what that looks like for Wyandotte County and around the metro area, and then a little bit about what we all can do about that to try to help reduce that and kind of start moving things to a point where we're not seeing as much COVID spread. So Dr. C, I'd be interested to hear you talk about where we are with this most recent COVID scorecard for Wyandotte County and what that looks like for our numbers and our risk level in the area.
Mm-hmm. Thanks, Janelle. Yeah, so we're still very concerned. And actually today, I think I want to just say it's time as a community that we're going to have to wake up together and we're going to have to work really hard to get these numbers down. Unfortunately, we're seeing that our percent positivity rate in Wyandotte County is still really high at about 22%. And the numbers that we're seeing, however, of positive cases on a daily basis continues to go up. And so we're, averaging around 65 new cases a day, which is very, very high. The biggest concern that I have and that we're dealing with here in the health department is we're seeing that our hospitals are getting to a point currently where they're overwhelmed. We just don't have many more beds left. And what's more, many of the hospital staff are actually out sick with COVID. So the level of community spread in Wyandotte County and in the surrounding metro area has gotten really, really high and pretty much out of control. And so at this point in time, we're going to have to, again, work really hard together, each and every one of us, to get that level of spread down, especially for our healthcare workers in our hospitals.
Thank you for that. And I want to remind folks that if they want to take a look at Wyandotte County COVID-19 data, they can go to wicokck.org/COVID-19 and click on the button that says COVID Hub to see the latest on that. All right, I want to move along to not just, where we are, but what we can do about it. I think when we hear stuff like this, we all wonder, okay, but what now? What do I do to, protect myself, protect the people around me? Julianne, do you want to talk about that?
Sure, I'm happy to. Everybody who's watching this right now likely already knows the importance of wearing a mask, of washing your hands, of staying 6 foot socially distanced. Those are the basics, but I honestly believe we need to be past the basics at this point. So what I would ask everyone is to think about what you were doing in April. Think about the choices that you made. Think about how you're able to work from home if that's at all possible for you. Think about how many times you opted to not go into that restaurant and dine in. We need to be at that level of caution right now in Wyandotte County. As Dr. Corriveau mentioned, our hospitalization situation is looking bleak. We are extremely concerned, and we've unfortunately let our guard down as a community. And so I know myself personally, I'm starting to go back to those old habits that we developed early in the spring and that really need reinforced. So yes, the social distancing is great, but what's even better, staying home. If you can stay home, we really strongly ask you to do that. And we especially ask you to do that in a time when we know it's going to be incredibly difficult because Thanksgiving is almost upon us. So the other thing we would really ask you to do is to think very carefully about the risk level that you're going to undertake in the decisions that you're willing to make around Thanksgiving. Who's going to be in that room? Who has a pre-existing condition that you could be exposing? What person is in an older age bracket that puts them at much higher risk? All of these questions, they're difficult and they demand sacrifice from us, but it's where we are right now. So I know you can hear the strain and the concern in our voices, and that's because it's real. And the other thing that I would mention is that we're making these difficult decisions ourselves as well. You are not alone. We are doing this with you. We are daughters and mothers and sisters, and this is difficult, but it's time to make these sacrifices for everybody in our lives. So we just urge you to make those with us and to stand with us.
All right. Thank you so much. These are tough conversations to have, but it's where we are right now. All right. Well, thanks everyone. We'll be back next week with more updates.
Thanks, Janelle.